I will stay on the ballot in all remaining states and continue to gather delegates. While Vice President Biden will be the nominee, we must continue working to assemble as many delegates as possible at the Democratic Convention, where we will be able to exert significant influence over the party platform and other functions. I hope everybody is coping in these very strange times. And before I go any further, I just want to say a special thanks to the many, many people all over this country and every state in our union who are literally putting their lives on the line to keep this nation going. And I'm talking about the doctors in our hospitals and our nurses and all of the medical personnel. We're talking about the paramedics and the ambulance drivers and the EMT staff. We're talking about police officers and firefighters and truck drivers and pharmacists, people who work in pharmacies. We're talking about all of those people who are out there today in these difficult and dangerous times who keep the nation going. So I just want to give a heartfelt thanks to all of you for what you are doing. Your service to our country will never be forgotten. Let me also thank our musicians tonight. I want to thank Sakamami for their great music. And later on in the evening, we're going to hear from Bon Iver and their extraordinary music. What I want to do tonight is to lay out as best I can in these very difficult times where I believe we are today as a nation in terms of the coronavirus pandemic that we're facing, as well as the economic crisis that we find ourselves in. I also tonight want to suggest to you how I think we can best go forward to address these crises, and further, what lessons we might learn from this moment as we advance into the future in forging a better and more just America. In other words, while tonight and right now as a nation, we have to focus on the crises we face, I think it's worth a minute, though, to be trying to ascertain what we learn from where we are, how do we get to where we are, and what kind of nation do we want to become when all of this is behind us, hopefully sooner than later. Now, frankly, I admit to you, I certainly don't have all of the answers to these questions, nor do I think anybody else does. In recent weeks, I've had the opportunity to, among many other people, talk to some of our leading scientists, trying to figure out, get a sense from them as to where they see this pandemic going. I've also had the opportunity to talk to some great economists, trying to learn from them as to how we can deal with the economic crises that we face. And I got to tell you, none of them have all of the answers either. I think we're going to have to struggle through this unprecedented moment together. And at the end of the program, I look forward to hearing your questions, your comments, and certainly you can email us with your ideas because essentially we are in this together in so many ways. But what I do know about the moment that we are in is that we need an unprecedented response to the unprecedented crisis. In other words, we've never been here before. The reason nobody has any great answers is we've never been in a position like this, where we have seen a terrible health crisis in terms of the pandemic of the coronavirus, and at the same time, same exact time, we're seeing an unprecedented economic downturn. So we have got to work together to figure a way out of this, and I just want everybody to know that along with other members of Congress, I am working on a major piece of legislation, which I'll be discussing tonight, that I believe can effectively address these horrific times that we are living in. Let me begin by saying that clearly the immediate crisis, the most pressing crisis that we face, is to make certain right now that anyone whose life is being threatened by the coronavirus gets the best medical care possible. And when I say anyone, I mean anyone, because it is absolutely imperative that all people, no matter what their income level is, no matter what their station in life is, no matter where they live, gets the best possible health care today that they can. And I am concerned that in many cases we are not seeing that if you're poor, if you're living in a minority community, you may not be getting the kind of health care that other people are getting. And that's an issue we have to focus on. As I think all of you know, as of today, some 8,000 Americans have already died from the COVID-19 virus, and over 300,000 have been infected. Clearly, our job now is to keep that death rate and infection rate as low as humanly possible. And among many other things, what that means is that the President of the United States, in a very forceful way, must use all of the provisions of the Defense Production Act to make certain that the private sector starts delivering the equipment and products that our medical personnel need in order to treat their patients. And let's give you an example of what I'm talking about. Dr. Wayne Riley, the president of the State University of New York Downstate Medical Center in Brooklyn, New York, said today, that his medical staff will have to start using rain ponchos and garbage bags instead of surgical gowns, and that his medical center only has enough gowns, protective gowns, to last for another day and a half. Can you believe that? This is in a major medical center in the largest city in the United States of America, and they're going to have to be using garbage bags to protect themselves. But of course, this is not unique to New York City. What we are seeing is that all across this country, our doctors, our nurses, and other medical personnel are putting their lives on the line to treat patients, to take care of patients, because they don't have adequate personal protective equipment. It is hard enough to do the kind of great medical work that our doctors and nurses are doing under the best case scenario, but imagine doing that when you don't have the protective equipment, the masks, the gowns, the gloves that you need. And in the wealthiest country in the history of the world, to say the least, that situation is totally unacceptable. As a nation, right now, we must determine in short order, what do we need and how fast can we get those products into the hands of our medical personnel and to all Americans who might need them. And I'm talking about face masks, we're talking about gloves, we're talking about gowns, we're talking about necessary hospital beds and ventilators, as well as the various kinds of testing kits that we need now and will be needing in the future. And furthermore, I am also talking about the dwindling supply of certain prescription drugs that are needed to treat this virus. What we are hearing now from hospitals, doctors' offices all over this country is they're running out of the prescription drugs they need to treat people who have been impacted with the coronavirus. In other words, the federal government must make a clear determination of exactly what we need. And we must start producing and acquiring those products as quickly as possible. States and hospitals in America should not have to compete against each other for a scarce and limited amount of product. The federal government must take the lead in coordinating efforts and in doing everything possible to make sure that all medical personnel throughout this country have what they need in order to do the important life-saving work that they're now doing. Further, we must also require OSHA to adopt a strong emergency standard to protect healthcare workers, patients, and the public during this crisis. And most certainly, we must crack down aggressively on price gouges and hoarders. Now is the time for all of us to work together to save lives. It is not the time for companies to be making huge profits. It goes without saying that this crisis has been exacerbated by Trump's initial downplaying of the crisis, his many inaccurate and misleading statements, and his inability to respond effectively to the dimensions of the pandemic. As a result, tragically, many, many lives will have been lost. During this crisis, it seems obvious to me that every American must be able to receive all of the health care that they need without out-of-pocket payment. As all of you know, our country was facing a catastrophic healthcare crisis before the pandemic, with some 87 million Americans uninsured or underinsured, and with us paying by far the highest prices in the world for prescription drugs. The layoffs that we are now seeing will mean that millions of people more will be losing their insurance, which could result in countless deaths and bankruptcies. In other words, when people are being laid off, they're not only losing their income, they are losing their health care as well. Already, in the last 2 weeks, an estimated 3.5 million people have lost their employer-sponsored insurance, and that number will clearly go up significantly in the coming weeks. 14 states, as you know, still have not expanded Medicaid, and increased Medicaid enrollment will put a tremendous strain on state budgets. According to various reports, the cost of hospital treatment for the coronavirus amounts to tens of thousands of dollars. Now, amazingly, what the last stimulus bill did is it said, okay, we will pay for you to get the tests that you need to determine whether you have the virus. But it does not pay for the treatment that people need if they have the virus. And that is, to me, totally absurd. And tragically, what we have already seen are people who have delayed treatment due to concerns about cost. They just don't have enough money to pay tens of thousands of dollars for treatment in a hospital. In this pandemic, uninsurance could well lead to unnecessary deaths and people not getting the treatment they need, which leads to the transmission of more and more virus to unsuspecting people. In order to solve this crisis, in my view, Medicare must be empowered to pay all of the deductibles, co-payments, and out-of-pocket healthcare expenses for the uninsured and the underinsured. No one in America who is sick, regardless, by the way, of immigration status, should be afraid to seek the medical treatment they need during this national pandemic. Obviously, we are facing not only a pandemic crisis, but we are facing an economic crisis as well. As I think all of you know, last week, 3.3 million people filed unemployment claims. This week, that number doubled to more than 6.6 million claims. That is, over a 2-week period, almost 10 million people have filed for unemployment. And that is far, far more unemployment claims than any time on record. Incredibly, more people have already lost their jobs in this downturn that we are experiencing right now than in the entire Great Recession of 2008. the Wall Street crash of 2008. Frighteningly, the St. Louis Federal Reserve projects that 47 million more Americans may become unemployed by the end of June, with unemployment reaching 32%. Now, that is what the St. Louis Fed is projecting. I certainly hope that they are wrong and that unbelievable level of unemployment does not take place, because that would be a disaster for the working families of our country. And we must, as we go forward, do everything that we can not only to prevent that disaster, but we also must prepare ourselves for a worst case scenario. And that is kind of what the legislation that I and others are working on. What we're trying to figure out is what is a worst case scenario and what role can the United States government play to protect the working families of this country. And I think the main point that I believe we must follow and appreciate is that our goal should be to prevent the collapse of our economy rather than figuring out how we can put it together after it crumbles. Okay, in other words, it is a lot easier to try to maintain the economy rather than putting it together after we have massive unemployment, hunger, and incredible stress on the part of the American people. And I think the most effective way to do that, simply stated, is to make sure that every worker in our country keeps receiving his or her paycheck. As some of you may know, in the last stimulus bill that was passed last week, Congress appropriated over $25 billion as part of that $2 trillion bill. Over $25 billion was appropriated in grants to the airline industry so that 2 million workers in that industry could continue to receive their full paycheck and benefits through September 30th. So let me repeat that, what we did for the airline industry. What we did is give them a large sum of money which goes directly to the 2 million workers in that industry who, through the end of September, will continue to receive their paychecks, whether they are working, some of them are, or whether they are not, most are not. And they will also continue to get their benefits. In other words, they have been made whole. And in my view, that is exactly what we must do for every worker in America. And I know people out there say, wow, this is really a radical idea. The truth is, it is not, because it makes a lot more sense than the alternatives that we might be seeing if we did not go forward in this way. And it is also very similar to the programs that now exist today in the United Kingdom, in France, Norway, Denmark, and other countries. In other words, what these countries are saying is that the best way to maintain their economy and the well-being of their working people during this crisis is to make sure that all of their workers continue to receive their paychecks. In my view, if we are to keep the economy from collapsing and also to address the unbelievable stress and anxiety that our people are now experiencing, all of you know, including many who are watching me right now, you are sitting there at home and you're saying, my God, I don't have any food in the cupboard. Or I can't pay my rent, I can't pay my mortgage, I can't pay my student loan, I can't pay my automobile loan. I don't know what's going to happen. We can address a lot of that anxiety by making sure that every American worker continues to receive his or her paycheck. And I know there are some people who are saying, well, that's a great idea. It is very expensive. Well, you're right. It is very expensive. But I think the alternative of not going forward in that direction and allowing the economy to disintegrate, massive unemployment, massive anxiety and hunger and homelessness, I think the alternative is a lot worse than spending the amount of money that we have to spend to make sure that workers continue to receive their paychecks. Further, on top of making sure that workers continue to receive their paychecks, we must get money into the hands of people as quickly as possible by providing a $2,000 monthly emergency payment to every person in this country until the crisis has passed. And we must ensure that that money goes out to the most vulnerable as well. And I'm talking about the homeless and the undocumented and the unbanked and those without internet connections. Now, in the last bill, that $2 trillion stimulus package, we provided one time, a $1,200 check for adults and $500 for kids. And by the way, the kids had to be 16 or younger, not 18 or younger. But I think we've got to do better than that. Furthermore, we must guarantee paid medical and sick leave to all workers. As many of you know, we are the only major country on earth not to guarantee paid medical and sick leave to our people. We're the only major country on earth that doesn't do that. During this crisis, it is absolutely imperative that we move aggressively and make that happen, or else what we are going to see is that workers are going to work who should not be going to work because they are sick. And what we know is that some 12% of workers in businesses today that are likely to stay open during this crisis are receiving paid sick leave benefits as a result of the second coronavirus relief package. Only 12%. That is nowhere near enough. Finally, in my view, and this certainly makes common sense, workers who are on the front lines of this crisis, including those who are working in grocery stores, who are working in drugstores, who are working in warehouses, paramedics, nurses, domestic workers, farm workers, truck drivers, and janitors, must receive hazard pay, childcare, and a safe and secure workplace. In other words, when people put their lives on the line, they deserve to be compensated in a fair way. Now, in the midst of this terrible economic crisis, what we are seeing is that states and cities are facing enormous budgetary pressures as their tax revenues decline precipitously. Remember, states and cities are the people who are paying the salaries of our police officers, our EMT staff, our firefighters, our doctors, and our nurses in many cases. And what we are seeing is that states and cities have already announced hiring freezes, budget cuts, and layoffs in response to an increase in spending on coronavirus response and a drop in expected tax revenue. Rural and safety net hospitals are literally at risk of going bankrupt. So what we need to do is understand that we are not going to be effective in combating the pandemic unless our cities and states continue to have the personnel to do the vitally important work that they are doing. And that means that Congress must provide $600 billion in direct fiscal aid to states and cities to ensure that they have the personnel and the funding necessary to respond to this crisis. The Federal Reserve must establish programs to provide direct fiscal support and budgetary relief to states and municipalities, as well as liquidity to the financial system to indirectly support lending to states and municipalities. We must also ensure federal funding parity for the territories, tribes, and the District of Columbia for any and all economic and healthcare relief programs. Furthermore, the immediate worry that I have right now is that there are a whole lot of people who have been living paycheck to paycheck. Their paychecks are not coming in, and they are very anxious as to how they're going to put food on the table for their kids. And this means that we need a program that guarantees that no person in this country goes hungry. And to complicate the difficulty of that issue is that you have many seniors who are kind of living in their apartments right now. They can't get out of their house. They're not going to the grocery store. So we have got to figure out a way as to how we bring food to a whole lot of people in this country who, for whatever reason, cannot leave their homes. But we need to be focused on the fact that many people now are struggling with trying to put food on the table, and it must be a major priority to see that those people do not go hungry. Furthermore, what we have got to do is to make sure during this crisis that people do not get evicted from their homes, that people do not lose their homes or lose their cars or go into bankruptcy. And that means that we must place an immediate moratorium on evictions, on foreclosures, and on utility shutoffs. This is the time, this moment, to make sure that everybody in America is able to stay in their homes, make sure that the lights stay on, make sure that they continue to have the telephones that they need to communicate with the rest of the world. So what I am describing to you now is just part of a major piece of legislation that I and others in Congress are working on. And the bottom line here is that at an unprecedented moment in American history, which is where we are all right now with the pandemic and with this severe economic downturn, the government needs to go forward in an unprecedented way. So these are not by any means all of the issues that major legislation has to address, but they are some of the core issues that we cannot ignore. Last point that I want to make this evening before I get your questions is that in this horrific moment, when all of us are worried about our friends and our family, and just hoping and praying that nobody we know comes down with the virus, that we do as good a job as we can to control the virus, that we get the vaccines as soon as possible, the treatments that we need as soon as possible, that we rebuild our economy as quickly as we can, that in the middle of all of this, I think it is not inappropriate to be trying to ask ourselves, how did we get to where we are today? And maybe where do we want to go when all of this is behind us? And I think some of the questions that we have to ask ourselves, and you have heard me say this a million times, is how does it happen that we are the only major country on earth not to guarantee health care to all people as a human right? And for all those people who spout the employer-based health insurance program, how great it is, well, not looking so great today. Because so long as people's health insurance is seen as a benefit of their job, when their job goes, so in most cases do their health care benefits. And I believe that if there was ever a moment to rethink our healthcare system, this is that moment. Healthcare is a human right. It's a human right whether you're working, whether you're not working, whether you're a kid, whether you're old, whether you're disabled, no matter who you are. Healthcare is a human right, and the fight for Medicare for all must continue. And I gotta say that in the midst of this crisis, I think more and more people see Medicare for all as the rational solution to our healthcare crisis. But above and beyond healthcare, I think we got to ask some other questions. What kind of society do we want to live in? I think in this moment, a lot of people are thinking about, what is really important? What should our priorities be as a nation, It strikes me, and I think many other people, that maybe we don't want to live in a nation in which so few have so much and so many people are struggling. I mean, one of the serious concerns and problems that we have right now is going into this crisis. We have 500,000 people homeless, sleeping out on the streets. We have half of our people living paycheck to paycheck. We have tens of millions of people earning starvation wages. So when the paychecks stop coming, when the economy heads south, these people who were in serious economic trouble before are in devastating positions right now. And I hope and believe that people are now thinking, how do we create an economy that is much fairer than the economy we currently have, where 3 people own more wealth than the bottom half of American society? And I hope people are thinking about, changing our priorities so that all of us are entitled to the education that we need, regardless of our income. That we continue to think, and it's interesting that right now, you're reading that in California, New York, elsewhere, states and cities are letting people out of jail because prisons are a festing place for this pandemic, and letting people out. And that's the correct thing to do. But we have to ask ourselves, what goes on in America when we have more people in jail, over 2 million people in jail, than any other country on earth? Why aren't we addressing immigration reform? What are we going to do about climate change, et cetera, et cetera? So I would hope if there's any silver lining in this terrible, terrible moment in American history, it's that maybe we start rethinking our value system, rethink our national priorities. So, having said that, I will do my best to keep you all informed about the progress that we are making in terms of this legislation. But there is no question in my mind whether the president likes it or not, whether Mitch McConnell, the Republican leader in the Senate, likes it or not, there is going to be, and there must be, a 4th stimulus package. I would call it an emergency economic piece of legislation that protects the American people in this very unprecedented moment in our history.